I think the challenges are ones that are not unique to gastroenterology. Every day you look some media, some publication, something that talks about physician burnout. I would take issue with that. Burnout to me means that you're doing the same task over and over and over and over again, and you just can't stand it anymore. And so you're burned out. I look at this as a situation where most of us would love to be able to do the tasks that we are trained to do and that we get up in the morning to do, to take care of our patients, to get some satisfaction out of doing that, but that we are inhibited from doing that from forces that are outside of our control. Probably the most obvious recent example was prior authorization, right? That would be a good example. That's not about burnout. That's about somebody getting in the way of us doing what we've been trained to do and what we went into medicine in general, and gastroenterology as well, to do, to be able to use the skills and the education and the experience that we've acquired to provide the best healthcare decision making and interventions for our patients. And when things get in the way of that EHR that you talked about at 10 o'clock at night, or the hedge fund that is changing the face, in particular of gastroenterology these days, that's to my mind the biggest threat to professional satisfaction and ultimately to the care that we can provide our patients. It's to some degree magnified in gastroenterology because the hedge fund market has been quite active and prominent, but I think it affects medicine in general, and that's my biggest concern: is do we get to do what we know best for our patients and what we're able to do, and how do we preserve that? What do we do to preserve our voice on behalf of our patients in the face of market and other activities that are tending to make that more and more difficult for us?